Nearly 100,000 people in Singapore had difficulties with basic activities like walking or dressing themselves last year. More than 69,000, or 7 in 10, were seniors 65 and above. It is the first time this data is tracked in the census amid a greying population. Nisha Rahim with more.
Meenachi Velasamy has been living in Ang Mo Kio for more than a decade. She's 80 years old, and one of her daily highlights is hanging out with friends at this senior activity centre. For over 20 years, she has been finding it difficult to walk.
My son, my daughter, I got the pension money every month.
In the census, people who have problems with at least one basic activity are mostly seniors. It includes showering, dressing and remembering. Such centres are where seniors can exercise and interact with others to help them cope better. Staff also check on seniors in their homes to make sure they are well. Across all ages, those with difficulties were more likely to live in 3-room flats or smaller compared to those with not a lot of difficulty. And as Singapore ages, the centre says more data will help it target outreach and initiatives better.
In terms of housing type, it is a good way, or it's a very simple way to identify and do our targeted outreach and support. But like I said, even there will still be outlying cases where even those living in 4-room or even 5-room may need assistance.
Almost all seniors with issues with basic activities live with someone, like their spouse or children. Only around 6% live alone. But even with someone at home, they may not be trained to give quality care, especially for those with dementia.
Caregivers, they already are very stressed, managing their loved ones with such issues, and center-based services usually have a caveat where if the client presents too much behavioral issues, they can reject to provide the service. So that would be one gap, I think, that seriously needs to be addressed.
But Mr. Lam says apart from basic activities, mental health and behavioural problems are other pressing issues. It can take months to detect such cases, which will go up as in a rapidly greying neighbourhood. Still, he agrees such data will go to helping Singapore craft better policies.
It will also tell you, do you need more care? And what kind of care? Because you have to think about, should this be senior activity centres? Should it be the carers that go to the home to help? Where do you site them? Do you site them within a HDB town? Then you have the transport issue if it's not within the HDB town.
Last year, Singapore had nearly 100,000 people who cannot perform or had difficulties with one basic activity.